Hello everyone. The technology that I've chosen to evaluate for this course is IBM Watson for Oncology. Given that Watson's name came up a few times during this course, I thought it would be a good idea to see what IBM Watson for Oncology does. As we know, cancer is a global burden. It's actually the second cause of death in the United States. In Australia, more than 126,000 people are diagnosed with cancer every year, and the numbers keep rising every year. On the other hand, medical information doubles every 3 years. So there's a huge amount of information that oncologists need to sift through in order to be able to make recommendations and give a treatment for their patients. The information includes new treatments, research, clinical trials, medical records, that they need to have a look at before they can make the decision. And searching through all this literature is a very difficult task for one person. So cognitive technologies are able to mine all this information and give support to the clinician who wants to make this decision. In 2013, the Memorial Sloan Kettering Research Center and IBM formed a partnership to develop Watson for Oncology, which is the cognitive system for oncologists to be able to find the right treatments for their patients. It uses analytics to draw upon all these different sources of information, extract entities and the relationships between them, and to be able to find the right treatments. So the way the treatments are offered is it provides a set of treatments based on the knowledge it has, as recommended for consideration and not recommended. And for each of these, it bounds its recommendation to a set of supporting evidence. For example, published literature that supports why Watson thinks this is not a recommended or this is a recommended treatment option. Watson for Oncology uses this massive corpus of information, including MSK's curated literature and rationals, over 290 medical journals, over 200 textbooks, and 12 million pages of text. It has the ability to extract structured information from unstructured information using natural language processing. For example, medical clinical notes of doctors can be fed into Watson for Oncology, and structured information such as patient age or gender or their blood type can be extracted from the clinical notes if that information is available. It can match patients to clinical trials, and the version that MSK has trained supports colon, rectal, bladder, pancreatic, kidney, ovarian, cervical, and endometrial cancer. So here's the user interface for Watson for Oncology. On the left-hand side, the top picture, you see a list of patient cases that the clinician is working on. Clicking on those patient cases will give the information about the patient. The doctor can add their notes, and the notes will populate this information, the patient attributes, as you'll see on the right hand side at the top picture. Down in the bottom, the left picture shows the different treatment plans that Watson has suggested for that particular patient. The one in green is the one that Watson suggests as recommended, and the orange ones are for consideration, and if there's any reds, that's not recommended. And by clicking on for example, by clicking on that recommended option, we'll see on the photo on the right hand side, bottom right, the rationale behind why Watson has chosen this, has recommended this treatment. It gives the supporting evidence for that treatment that's been selected by Watson. So the evaluation framework that I've used to evaluate Watson for Oncology is the triangle model. That's been one of the models for evaluating health IT. In this model, there's three main components. There's the technology, which here is Watson for Oncology. There's the organization that uses this technology, and this could be, if, in our case, could be any cancer center in the world, or it could be oncology units within hospitals. So large organizations, or it can be smaller organizations such as private oncologists who are interested in having a decision support system to help them uh, find better treatments for their cancer patients. And the provider would be obviously oncologists who are dealing with cancer patients. Watson for Oncology is now available to be adopted by any organizations around the world. The system can be used as MSK has trained it, or it could be customized for the new organization's need and for new cancers. In the case that customization is needed, a team from that organization need to work with IBM to do this customization, and the timing will depend on how different this is to previous cancers and the MSK configuration. Oncologists need to be trained to use this system, but the user interface is very user-friendly and intuitive. So it should be an easy process for oncologists to learn to use this system. The system can be accessed through a web browser or a smartphone or iPad. In terms of user satisfaction, MSK currently uses their system, and according to their CEO, this has the potential to revolutionize medicine. Their CMIO also says that this is like having a very experienced colleague that you can turn on to get consults. Also, in the past couple of years, there's been a lot of literature in the American Journal of Oncology about evaluating Watson. One of the interesting ones that I found during this evaluation was from the Royal Melbourne Hospital here in Melbourne, where they evaluated Watson for Oncology for lung cancer patients. And they showed that 94% of the time the treatment that Watson for Oncology recommends matches the treatment that the doctors in Royal Melbourne Hospital would recommend. And did train Watson using doctors' patient notes, radiology reports, histology, and cytology reports. But they also conclude that if we were to train Watson on local Australian data, this accuracy can improve. Other studies have also showed that Watson for Oncology is capable of being trained for new cancers. Using WFO, patients anywhere in the world can get the same level of treatment that an MSK patient would get. That means patients who live in rural areas and areas that they don't have access to high-profile medical facilities can get the same level of treatment from their local oncologists using the system trained by MSK. The system, however, needs continuous training in order to be able to perform well in all different categories and for different patients. For example, an evaluation done by MSK showed that the system does not work well for all the patients with comorbidity illnesses. So obviously further training in this space is required. And the system is also being adopted globally at the moment. As an example, Burman Grant International Hospital in Thailand is planning to use this system to improve cancer patient care in Bangkok. So to summarize, WFO can be used as an assistant to oncologists. Its performance is promising according to what MSK and other centers in the world have reported. Using this system, a patient can receive the same quality of care as MSK anywhere in the world. Other centers are now starting to adopt this technology, and the system can be customized for new organizations and new cancers. Watson for Oncology needs to continuously learn. Further training is required for new cancers and new centers. Also, if new sources of information become available, those sources need to be incorporated into the learning system so that Watson for Oncology can get better accuracy in what is predicting. In addition, incorporating clinician feedback would be interesting in the system. For example, if a clinician decides that they want to do something very different to what Watson has recommended or something that Watson has not recommended, incorporating that into the system for future retraining would be an interesting thing. So here's my research strategy and my references. Thank you very much for listening. If you've got any questions, you can find me in the class or send me an email.